Welcome everyone to the Moisky News for May the 1st, 2020. Before we start, there is a political recap stream here tonight, 9:30pm GMT. I have yet to set it up, so please keep your eyes open for it. Today I'd like to talk about Boris Johnson's first press briefing since returning to work after having been struck down by the coronavirus. Now he has for the most part claimed that the United Kingdom is past the peak of COVID-19 and on a downward slope, something supported by the current numbers. However, those numbers are inaccurate. But lockdown will still be in place until June at the earliest. The latest figures suggest that 26,771 have died from COVID-19. As earlier stated, this is inaccurate. For the UK to ease lockdown, it must meet 5 of 5 tests that the government has come up with. The first is making sure the NHS can cope. Now, at present, it is clear that the NHS is actually in a good position to cope, with the NHS providers that represent the hospitals saying they're increasingly confident that the NHS has capacity to get through the peak. A lot of this comes down to the fact that they did in fact cancel selective surgeries, freeing up a lot of time, a lot of bed space, and of course those who don't need to go to hospital are now not, because they're hypochondriacs, going to hospital. The second test, a sustained and consistent fall in the death rate. For the past few weeks it looked like the number of deaths might be slowing, but it has been a bit tricky to call. A new analysis shows that the peak has been passed nearly 2 weeks ago. This is that peak, by the way. The third, rate of infection decreasing to manageable levels. This one is a little harder, because there is limited testing outside hospitals at the moment. It is up to 81,000 a day. Only key workers, healthcare staff and care home residents are being tested, and that only amounts to a few thousand a day. So that means ministers are having to rely on numbers being admitted to hospital with coronavirus as a guide. Therefore, inaccurate. Fourth, to ensure the supply of tests and PPE can meet future demand. Currently the UK has a capacity of 81,000, although only about a third of that number are actually being tested. That's because testing centres are nowhere near a lot of people that need to be tested. The fifth test is being confident any adjustment would not risk a second peak. Without a vaccine, this one is the hardest one to meet. It relies on widespread community testing and requires the government to give itself wiggle room to respond if infection rates start to climb, which is why Sir Patrick is aiming for an R0, reproduction rate of 0, of well below 1. So where does that leave us when it comes to the lockdown? Because of those 5 tests, we are not in a position to ease the lockdown. Until they are resolved, nothing changes. There was a chart I remember seeing that showed which type of businesses would be reopened as we were able to ease the lockdown based on a red, amber and green. Rather unsurprisingly, gyms were lost. Sad face. Anyway, back on topic. The reproduction number is a way of rating a disease's ability to spread, and it is the average number of people that one infected person will pass the virus on to, with Boris being quoted as saying nothing we do should lift the R back above 1, R being reproduction rate. The government's chief medical officer, who was present at the press briefing, said that we are absolutely confident that the wrong answer is anything over 1, explaining that as soon as the R rises above 1, you restart exponential growth, and sooner or later the NHS would be at the risk of being overwhelmed. When asked about the UK's response to the pandemic, Boris said that he thought it was right to make our period of lockdown coincide with the peak of the epidemic, which he is correct about. And when asked if the UK economy has to wait as the government continues with the lockdown, Boris said it was vital to avoid a second peak because that would do economic damage. That's why we've got to calibrate our measures so carefully and make sure that we are not only unlock the economy gradually, but also find ways to continue to suppress the disease. With him finishing up saying, I'm not going to minimise the logistical problems we've faced in getting the right protective gear to the right people in the right place, both in the NHS and care homes. But what I can tell you is that everyone responsible for tackling these problems, whether in government, the NHS, Public Health England or local authorities, we are throwing everything at it, heart and soul, night and day to get it right, and we will get it right. Not going to lie, the first thought I had upon watching him give this press briefing was, it's great to see him back working. He is, because he has gone through this, a beacon because of it. And that's great to see him lead by example and get back to work. Hopefully, he continues to recover, and hopefully this lockdown will end soon. With this, I would like to know what you think about it. About Boris being back at work and what he has said, along with the 5 tests. I will link those 5 tests in the description down below, so please do let me know in the comments.